Good. Good morning, everyone. I'm Betty Jean McKee. I'm a volunteer with the Grand River Council on Aging, and I'm pleased to be able to introduce our guest speaker this morning, Ashley Mansour. She is an RPN that has an extensive education. She started her nursing working with the physically and developmentally challenged people. And through her mother, who also had a lifetime history of working with geriatrics, she went into geriatrics and palliative care. Excuse my voice. She, having worked at John Noble Home for many years, she did go back to school. She has 3 children that are very active and has extracurricular activities. And the shift work didn't work for her, so she went out into the foot care area. She took her further training and became certified in the advanced foot care certification. Now she is a mobile advanced foot care nurse, and her company, AM Vital Souls, is her new business venture. Her goals are health teaching and education on the importance of foot care for seniors, and with combining her nursing experience. And I'll hand it over to you, Ashley.
But it's everybody's guide to healthy feet for seniors. It's based on Public Health Agency of Canada, the Diabetes Canada Clinical Practice Guidelines, and the RNAO, which is the Nurses Association Best Practice Guidelines as well. So today is March 11th, 2026. Next. Why healthy feet are essential for independence. So these are the things that we're going to discuss today. How aging naturally changes your feet, common foot problems seniors face, what diabetes can do to your feet and why it's serious, daily foot care routine, step-by-step, warning signs that need medical attention when it comes to your feet, and how your nurse and healthcare team can help you. Next. So a few quick little stats about your feet and seniors in Canada. 3 in 4 people develop serious foot problems as they age. 59% of seniors report inspecting their feet daily, but critical practice is early detection. 65% of people with diabetes, will develop some sort of nerve damage in their feet, which is called neuropathy. 1 in 4 of older adults will develop a chronic foot issue. And the #1 cause of non-traumatic lower limb amputation in Canada is from diabetes and somebody having a wound that was not looked after early. Next. So understanding your feet, how age and health conditions can affect your feet. So the first would be skin. As you age, of course, skin becomes thinner, drier, and loses its elasticity. Cracks and sores can form more easily. The padding on your feet. The pads on the soles can thin out. Less cushioning, which causes more pressure or pain. Your nails can grow thicker, harder, and even more brittle over time. Circulation, blood flow naturally slows. Feet can become cool, and it heals more slowly. Sensation, nerves become less sensitive. Injuries can go unnoticed. Flexibility, your joints stiffen, making it harder to bend down and inspect your own feet. Shape, foot shape can change. Bunions and hammer toes become more common. Next. So bunions, they're bony bumps at the base of your large toe. Hammer toes are toes that curl or bend abnormally. Corns and calluses are thick, hardened skin from pressure and friction. Ingrown toenails, nails that grow into the surrounding skin that can become infected and very painful. Plantar fasciitis, heel pain from inflammation from the plantar fascia on your foot. Athlete's foot is a fungal infection that causes itching, burning, and cracking. nail fungus, thick discolored brittle toenails. Peripheral neuropathy is the loss of sensation in your feet, and that's very dangerous. Diabetes in your feet, the most important connection seniors must understand. So diabetes can affect your feet in two critical ways. So the number one way is nerve damage, which is peripheral neuropathy. You may not feel the pain, the heat, the cold, or the injury that's happening to your foot. A small cut or blister goes completely unnoticed. Unnoticed injuries can become infected quickly. The danger grows with every hour that it's untreated. The second part is poor blood circulation. So that's peripheral artery disease, which is less blood flow, and that creates slower healing when you do have a cut or sore on your foot. Infections spread to deep tissue rapidly. Even a small wound can become a serious ulcer in a diabetic. And then you have increased risk of gangrene, which is tissue death. The danger is that you cannot feel the problem, but it is happening. So falls can be a leading cause of injury related to death in Canadian seniors. How feet can affect your fall or risk of falling. Feet pain changes as you walk. It can alter your gait dramatically and increase your risk for fall. Numbness in feet impairs proprioception, which is knowing where your feet are in that space. Ill-fitting footwear is a major issue, but can be preventable for a fall risk factor. Thick and painful toenails affect how you place your feet with each step. Foot deformities, like the bunions and hammer toes that we spoke of earlier, alter your walking pattern. But the good news is treating a foot problem can reduce an unsteady gait. Proper footwear can dramatically improve that balance. Regular foot care keeps you walking confidently. Your daily foot care routine. Simple habits that can save your feet. Step 1. If you sit in a well-lit area, have a small mirror or magnifying glass handy, or ask somebody else to help. Step 2. Look at the tops of your feet. Check for redness, cuts, swelling, or blisters. Step 3. Use that mirror to look at the bottoms of your feet. Check for sores, discolored areas, or pressure spots. 4. Check between each toe. Look for cracking, peeling, moisture buildup, or sores. Step 5. Notice if there is an unusual odor. This could signal an infection, even without a visible sign. Step 6. Feel your feet. Notice an unusual warmth, any hard areas, or any new numbness. If anything is unusual, contact a nurse or a doctor right away. Don't wait until it hurts. By then, it may be already too serious. So when it comes to daily foot hygiene, simple steps are what matters. So make sure you wash your feet every day with warm, not super hot water. Make sure you test that water temperature with your elbow, not your foot, because again, that's a burn risk. Safe water temp is 98.6 or 37 degrees Celsius. If you need to use a bath thermometer, that'll help as well. Wash gently between all toes and dry feet thoroughly. This is actually a huge thing that I see in the community, is that people don't dry in between their toes thoroughly, which can cause, a growth. So wash between all those toes, dry the feet thoroughly, apply unscented moisturizer to the tops and bottoms, but try not to put the moisturizer in between toes because, again, for skin breakdown, too much moisture in between the toes can actually cause more issues. A good cream for feet has 40% urea in it. So as long as it has a urea base in it, it's really good for cracked and sore feet. Don't soak feet longer than 10 minutes. Do not use a heating pad or water bottles on the feet because it can be a burn risk. Walking barefoot. I know I have for years. It's actually not the best for your feet. We're not meant to walk on really hard surfaces. So actually wearing socks or slippers indoors is very important to do. Apply moisturizer between toes. So again, make sure you're not doing that because it can lead up to fungal infections as well. Diabetics should not use medicated corn removal products. They contain an acid in it that's dangerous for diabetics. Cutting your own corns and calluses. Again, for diabetics, it's a risk for cutting your actual skin as well. Ignoring any new wound, even a tiny blister. So even a small blister really should be monitored at all times. How to trim your nails safely. So the best practice way to trim your nail is actually straight across. Never curve the nails at the corners because that can lead up to ingrown nails growing back because you're curving your nails unnaturally. Cutting to the end of the toe. You don't want to do it too short, but you don't want to obviously leave your nails too long as well. Using proper nail clippers designed for toenails and not scissors. File any sharp edges with an emery board. Trim nails dry. Wet can actually introduce infection. Always use good lighting. Inspect the nails and the surrounding skin. When to see a nurse or a podiatrist. If your nails are too thick, curved, or hardened. If you have an ingrown toenail, especially if it's red, swollen, or it's draining. If you have diabetes or poor circulation, always have a professional trim your nails. You cannot safely reach or see your feet due to mobility or vision issues. If in doubt, see a foot care nurse or a doctor. It's important to cut the nail properly because if it's not, it could lead to serious infection. So choosing the right shoes, what the recommendations are. What to look for in good footwear. So the fit, thumb's width of space at the toes, no squeezing of your toes of any sort. The toe box, make sure it's wide enough, nothing's pinching or putting pressure on your toes. Support, you need a good arch support and cushioning on the insole. The sole, it's non-slip, sturdy, flexible sole with a good grip. Material, breathable material, leather or canvas is preferred because it's easily wiped down and washed as well. Heel, a low heel, no more than 2 centimeters. The closure, easy Velcro, elastic laces if you have arthritis. That's just easier for you to put on your own shoes. Shopping tips, shop for your shoes in the afternoon. Your feet actually swell if you're doing activities or walking a lot during the day. Always try both shoes on. Sometimes your feet are actually different sizes. Break in new shoes gradually, wear for short periods of time at first. That way you're not creating any blisters or any skin breakdown. Replace worn shoes. The support and the grip are gone. They actually recommend that you should be replacing your shoes every 2 to 3 years. So never go barefoot, even at home. Make sure you're wearing like a non-slip slipper. Where wearing flip-flops as an everyday footwear is not the best either. It's okay around the pool or on the beach, but wearing them every day, like those really thin flip-flops aren't the best for you at all. Wearing socks with tight elastic bands at the top. Definitely don't want to cut off any sort of circulation to your feet. So exercise and circulation, keep the blood flowing to make sure you're moving those feet. So these are exercises that can be done sitting in a chair, anytime, anywhere. You can do them to keep the blood flowing. So ankle circles, lift one foot off the floor, slowly rotate the ankle clockwise. You can do that 10 times and then counterclockwise 10 times. Repeat with the other foot. This actually improves ankle and joint mobility. 2 is toe curls and spreads. Curl all the toes tightly for 5 seconds, then spread them for 5. Repeat 10 times. It activates the small muscles in your foot. Heel and toe raises, raising the heels off the floor like a tiptoe position, and then putting the heels down back to the floor. It actually helps pump blood to your calves and to your feet. Seated marching. Lift knees alternately as if marching. 20 repetitions, again, helps with blood flow to your legs and your feet. Calf pumping or standing, holding the sturdy chair for balance. Rise up on your tiptoes slowly and then lower them. Again, exercise for great circulation. And then the foot alphabet. Lift one foot and write the alphabet in the air with your big toe. Then switch feet. It's a fun, effective way to improve your range of motion. Walking remains the best overall exercise for circulation and foot health. Warning signs and when to act. Know when to call a healthcare team. So see your healthcare provider immediately if you notice any new wound, cut, or blister that doesn't heal within 2 or 3 days. Skin turning black, dark blue, or any sign of gangrene. Sudden increase or loss of pain and sensation to your feet. A new ingrown toenail that's red, swollen, or has any discharge. Signs of infection, redness, warmth, swelling, pus, or a bad odor. A foot or leg that's suddenly much more swollen than usual. Deep cracks in your skin, especially around the heels, and then they can bleed. Or any sort of fever combined with any foot or leg wound. For people with diabetes, any wound is always an emergency. Do not wait to go get it looked at. So your healthcare team, you don't have to do this alone. So foot care nurses are specialized in advanced training in foot and nail care. So they do an assessment, a full medical history review, and complete a health evaluation. They do safe nail trimming for fungal nails, ingrown nails, and difficult cases. Sensation testing, we do monofilament tests that detect neuropathy, which is the loss of sensation in your feet. We also provide personalized foot care teaching tailored to your specific needs. A physical exam of your skin, nails, circulation. Skin and callus treatment for corns, calluses, dry and cracked skin. A vascular assessment, which is checking your pedal pulses and skin temperatures for circulation issues. And then referrals, if necessary, to a podiatrist, chiropodist, physician, or a wound care specialist. A foot care nurse is not just for a pedicure, it's actually a clinical assessment. So who else can help you with your feet? So again, the foot care nurse is specialized training. It's usually the first point of contact for foot care needs. There's a podiatrist or a chiropodist, which is very similar. There are foot specialists. They can do surgery, orthotics, and complex wound care. Your family doctor or nurse practitioner, annual foot exam for diabetes and referrals and medication management. A diabetes educator. They're good to help you with blood sugar control, critical for your foot and for healing. An orthoist, which is a customs orthotic and therapeutic footwear person. A physiotherapist, balance, gait training, and exercises. And then there's a wound care specialist if you do have a wound for advanced wound and ulcer management. Don't be afraid to ask for referrals. It could really save your feet. So this is more for diabetics, but 80% of amputations are preventable. The pathway for amputation and how we can stop it. Uncontrolled blood sugars, nerve damage and poor circulation, small injuries that go unnoticed on your feet, wounds that become infected, infection spreads to the bone, and then that can lead to amputation. So it's just important to control your blood sugars, make sure you're wearing proper footwear. Early wound treatment, like I said, any wound is critical or serious if you're a diabetic. Daily foot inspection, regular professional care, and access to your healthcare team. Make sure that everyone's aware of what's going on with your body. So the foot care checklist every morning: put on clean, seamless socks, check inside of your shoes for foreign objects before putting them on, wear supportive, well-fitting footwear, no bare feet, often trim your toenails straight across, check for footwear, proper fit and damage. Every evening, obviously remove your shoes and socks, inspect your feet in good light, wash your feet with warm water and dry them thoroughly, even between the toes. Apply and scented moisturizer to those dry areas, just not between the toes. Do those circulation exercises daily because they can only take up to 5 minutes. If you're doing them, once a day, you can do a 5-minute circulation exercise. Keep your blood sugars in control if you have diabetes. Make sure you see a foot care nurse every 6 to 8 weeks, and an annual foot exam with your doctor is essential, especially if you have diabetes. If something doesn't look right, make sure you call a professional. So, Public Health Agency of Canada, Foot Care Information Sheet for Seniors is a great resource. It covers daily care, hygiene, footwear, and the exercises. So remember these things. Check your feet every day. Oh, that's okay. We went back. So Diabetes Canada was also another resource I used for foot care guidelines and amputation prevention. It's a great resource to find information about your diabetes and diabetes education in your area. The Registered Nurses Association of Ontario has a great guideline for best practice for nursing reference, so you understand what nurses can do for you. It's definitely evidence-based standards for foot care nursing across Canada. Your local community healthcare center. Foot care nursing services may be offered subsidized or free care. A lot of my services can be covered under private benefits, or you can claim them on income tax. Your family doctor, nurse practitioner, or any sort of public health unit for a referral for foot care. So just make sure, again, you're talking to your doctor or nurse practitioner for any sort of referral for foot care. And then remembering the 5 most important things is checking your feet daily. 2 minutes can save your feet, your mobility, and your independence. Never go barefoot, even at home. Always wear clean, supportive, non-slip footwear. See a professional regularly. Foot care nurse, podiatrist, or a doctor. They're partners in prevention for your foot care. If something's wrong, act fast. For people with diabetes especially, any wound is urgent. Do not wait. And then you can prevent serious complications. All amputations can be preventable with proper care and early detection. So your feet carry you through life. Make sure you take good care of them. And that's a wrap for me. Thank you very much. Again, I'm Ashley Mansour. I'm an RPN and I'm a mobile advanced foot care specialist. I have a business of my own, which is Vital Souls, and you can contact me for any sort of assessments. That's it.
Before
Thank you.
we get going on questions,